Hello. I first got started with YouTube channel about sometime in 2015, and I nothing really did come of it. And I think during COVID again, I started a little blog just for myself personally, and I stopped doing that as well. And then 2019 comes, and I started attending school again to get my psychology degree, my doctoral degree. And I recently just finished, and I feel amazing. The anxiety is not as overwhelming anymore. Being a adult learner, it's definitely was a process. And going for psychology, you think like, oh, somebody who's going in that field has all the answers, but unfortunately that's not the case. That wasn't the case, and that's still not the case. But it's just amazing that it's over. But the reason why I started again is because I wanted to just share some of my own experiences, my own perspective, and I do understand that nobody's asking for it. So it's just me wanting to share my own experiences. And as I said, anxiety was a big part of the process for me. Sure, I mean, we all have a little bit of anxiety every now and then. In that, we get nervous when we're excited about things, and sometimes that can be a little bit overwhelming. While some people have like truly fearful anxiety where that kind of stopped them from actually moving forward. So I definitely wanted to, throughout posting, I'll talk about that a little bit more, just anxiety in general. Different types of anxiety, of course, because there are different types of anxieties, not just in general. But yeah, disclaimer, not because I said, I'm now a doctor in clinical psychology, that doesn't mean that this is a page to provide or share information about how somebody may get better if they're dealing with anxiety or depression or anything like that. You still need to speak with someone who able to provide you, understand and provide you the support that you need. So this is not a place where you can come and get some type of cure or fix or anything like that. So that I just want to share that. And of course, this is my personal experiences, my perspective. It's not a one-stop fit all. My experience might not be the same as another person. Something that might help me might not help someone else. So I just want to make sure that that's clear. Lately, it's just after finishing school. Of course, as I said, it feels amazing. Just being in this category of people who have achieved such a huge level of accomplishment. But yes, I finished May. I defended my dissertation in May. I finished school in June. Our graduation, because it's an online school, is actually in September, but I'm not actually traveling because it would be in San Antonio. And I'm not actually going to San Antonio. I decided to do my own graduation, just a celebration of my accomplishment in a more private way. But I realized that even just, sharing with others or people that I meet along the way, that I'm a psychologist, people love to share, which is great. It's great to share, somebody to listen, because, that's what I get paid to do, is to listen, right? But I find that more and more as I talk to people and somehow the topic of what I do comes up. It's a matter of like, I feel like I never leave the clinical room, of course, but that's okay. But specifically today, I just wanted to kind of introduce myself a little bit, who I am, why I'm here, or why I'm doing this. And for me, as I said, I'm doing this because I know that anxiety is a huge thing. Since COVID, there's been like a lot more need for mental health, for people to take care of their mental health, to seek out support. Even if it's somebody who is close, even though I know sometimes it can be overwhelming for family members. So seeking out professional support can be beneficial, will be beneficial, hopefully, finding the right person, right? So I definitely employ people that if you are looking for somebody to talk to, if you're going through something right now, it's okay to reach out and ask for help, or just to have somebody to speak to when things are just not going right. This is a short video. Before I finish, I just want to share something that recently happened. My mom, Jamaican background, by the way. My mom recently came from Jamaica about 2 years ago. She doesn't live in I live in New York. She doesn't live in New York. She lives in a different state. And recently, she went to the doctor, and she was given this medication. It's kind of backwards, but she was given this medication. She didn't pay for it. I think it was a trial that the doctor had available, and he gave this to her. Now, my mom suffered from high blood pressure, and of course, sometimes she gets excited. She sees people she wants to share and she wants to talk, and I keep trying to tell her that, when a doctor asks you a question, they simply just want to know if it hurts here or if it hurts there. There's a different doctor that deals with the talk part of the issues that might be going on. But anyways, she went to the doctor. She was having issues with high blood pressure, and she was blacking out because of it. Her blood pressure was very high. The doctor gave this to her, and when I decided to go ahead and look it up and see what type of medication this was, because I don't prescribe medication, and I'm not an MD, I'm not a medical doctor. So I wanted to get more information about this drug and what it does, and if it's something that could potentially help her with what was going on. When I actually look it up, this medication is actually more prescribed for behavioral health. So somebody who might be suffering from bipolar disorder or even schizophrenia, and some of the side effects actually is cause high blood pressure. So it's not something that you'd give somebody who's already experiencing high blood pressure. But the biggest takeaway from this is we have to ask more questions. I know doctors are here and there, which we're supposed to trust them because they went to school and they got this elaborate education and everything. And not to say, some doctors are not wonderful and great. They are. But there's some that, unfortunately, because of the fact that they work so hard, they work long hours, sometimes they're not fully there, or they're not fully listening, which I think one of the biggest tools is making sure that we're listening to what our patients are saying, or what their ailments are when they show up in the room, or show up in our office, asking for help. But long story short, the point is, when I did speak to this doctor, because after I looked the medication up, I wanted to make an appointment to see this doctor with my mom to kind of just speak on the fact that, she was being prescribed something for a diagnosis that, from my knowledge and from her history, I wasn't aware that she had any type of mental health conditions that was diagnosed. When I met the doctor actually was very rude. He was very rude. He basically told me that I shouldn't be trying to treat my mom and stuff like that. I'm like, I'm taken back. Like, I'm not trying to treat my mom. I'm trying to advocate for my mom and finding out why you gave this to her. Because when I asked my mom questions, she didn't have any answers. When I asked my mom, what about the summary from the visit so I can read it and see what was, what was going on, what was said, and what was done, she didn't have it. So it's like, the point is we have to ask more questions, just to be knowledgeable. You put in stuff in your body, you want to be aware of what you put in your body. What side effects is gonna, it's gonna affect you once you put these things in your body. And is it something that you can in the long run live with, right? But the point is, met the doctor. It didn't go very well. I think for him, he was already on the fence because he did something that was not right. To an extent, I wasn't there. I wasn't sure what was said between himself and my mother, this internist, and my mother. But either way, he gave her something that instead would cause more harm than actually good. And I think one of the things that we learn when we go to school is we want to try to minimize the harm, right? If we can. If there can be no harm altogether, that'd be awesome. But I think when it comes to medication, there's always some type of side effects that you have to deal with. And for that whole experience, it was actually terrible. It was really awful. And I just hope that, takeaway from this is that if I can share anything with anyone, is that please ask more questions, be more informed. If you don't understand, or let's say that the doctor and yourself doesn't speak the same language, don't take anything. Make sure that you understand the communication is on the same page, and you understand what things are being given for, what could potentially happen. And if you don't understand, or if you're not getting information that you need, ask questions. It's always important to ask questions. And I think sometimes we don't ask questions because we trust so easily. There's nothing wrong with trusting, but we have to take our health into consideration when we put things, as I said, in our body, or we don't ask enough questions, or we're afraid to ask enough questions. And if you're not able to ask questions, have somebody there to support you that's able to advocate on your behalf. But yes, I just wanted to kind of leave this video with, I still don't understand. I have a bunch of these, and I do intend on throwing them out, but I just wanted to do a video about, like, be careful of what you're taking and be careful of what you're being prescribed. Make sure it is something that's going to help you, and it's something that's going to be, the harm is going to be minimized, rather than something that's actually going to cause more harm. And then good. I'll be back. I'm going to try to do a little mini video, because I really don't have any following anyways. So I'll do a mini video every week, and just talk about something, or talk about something that's going on. It's nice to be on here. I hope that this can help someone or multiple people. I'm sure anything that I'm saying here is not something that's new. And yeah, see you guys next time. Bye.